Hey girl, Marissa here. You are listening to the Codependent Dummy podcast. As a young woman, you have been raised, reinforced, and rewarded for putting the needs of others above your own. Now, in your 20s, you're finding yourself exhausted, exasperated, and enveloped in shit relationships, especially the one you have with yourself. Codependency is a way of being where we put the feelings, wants, and needs of others above our own in an unconscious attempt to meet our own feelings, wants, and needs. Sorry to break it to you, sis, but that is not sustainable. This podcast is to help you undo all that so you can stop playing small and start taking up space, you dummy. Let's get to it. Hello, everyone, and welcome back to the Codependent podcast. Today, we are meeting with Dr. Sharleen Lawrence. She practices traditional Chinese medicine, is a licensed acupuncturist, certified hypnotherapist, and the founder of the hypnopuncture method. Sharleen, thank you for coming on.
Thanks, Marissa. I'm excited.
Awesome. All right, so we'll start with the typical two. I'm curious, Sharleen, as a practitioner of traditional Chinese medicine, how do you conceptualize the condition of codependency?
So I've been thinking on this question, and I think it's so broad, really. So traditional Chinese medicine, TCM, is very broad. Codependency is very broad. And obviously, you're the expert in the codependency. And I think that we all have codependent tendencies, either at some point in our lives with certain people. And how I conceptualize this is really just figuring out who we are as an individual, figuring out how we fit into those social groups within our life, whether that's with our partner, whether that's with our parents, our groups of friends, and how do we separate those out? And in Chinese medicine, which again, I'll repeat, such a broad category. But when I think back to the ancients, 3,000 to 5,000 years ago, when what we now call traditional Chinese medicine began, there was a lot of introspection. There was a lot of tools to learn who you are as an individual. How do you fit into society and the different parts of society? And I think we've lost that in the last several thousand years. And so if we can get back to those tools, which we'll talk about later, I'm sure, but one of those things would be like Tai Chi or Qigong. Even yoga plays into that. Very, different region, similar practice. But focusing on those tools that we still have today in our modern era can actually lead us to that individualism, as well as teach us where we fit in the grand scheme of our society.
Right. Okay. So I'm hearing that, yes, we all have codependent tendencies at different times with different people. And you sense that codependency is like those times when, like you said, like we don't necessarily know who we are as individuals and we don't reflect on that. We're just lost in relationships.
Yeah.
Okay. And Dr. Sharleen, do you have any codependent experiences from your own life that you can share with us?
Absolutely. I was just perusing this morning before we hopped on in preparation. I have a book that I have yet to read, and I read through the first chapter and was like, why was this sitting on my shelf for so long without reading it? And oh gosh, the name, it's called Codependent No More.
Right.
And I'm guessing you're familiar with the book, and there's a
Yes.
workbook that comes with it as well. And I have both. And this was a suggestion that was made to me by a coach that I had hired many years ago. So I hired a coach to help me in my business. And what ended up happening is that we spent the entire 6 months working together, working on my marriage. She was helping to coach me through my marriage. And she had made the recommendation of getting that book because there are still a lot of codependent tendencies that I lean into. I'm sure my husband does as well. And I can only speak about me and my feelings. And what has really helped me in recent years, not having read the book yet, is learning to take responsibility for myself. How am I responsible in a situation? I am responsible for my feelings. And the biggest thing that has helped me in any situation, whether that's in my marriage or even with patients or the staff in my clinic, is when something puts me into an emotion that I don't want. Like if I'm angry, if I'm frustrated, if I'm not feeling heard or seen, the most powerful thing that I've learned to do is to ask myself, what about this is about me? So when I'm upset with my husband, I can only see in him what exists within me. So if I'm upset with him, then I need to ask myself, what about this is about me? And that will allow me to reflect and determine really it's something I'm upset with myself, and I'm only projecting that onto him. And so that's really where I think the codependency has transformed, is now I'm not blaming him. I'm not trying to force him to change. And I see that in all relationships in my life. And so I'm able to say, how is this about me? What about this is about me? And it allows me to move on because, I learn things about myself, the good, the bad, and the ugly.
Right. Is there an example from before you had these reflective questions that comes to mind when you did blame him or you were forcing him to change?
Oh yeah. There's probably many examples. I think the biggest, maybe broad one that appears often is that my husband is very clean. He's undiagnosed, but very, if I were a mental health professional, I might diagnose him with having some OCD issues, obsessive compulsive disorder problems. And that is something that we just talked about this the other day. He will clean, and then I feel like I can't touch that, like he'll wipe all the fingerprints off the fridge. And then I feel like I cannot go to the fridge, even if I'm hungry or need to get water out of the fridge, because he just cleaned it. So I was trying to change him to make myself feel better. Well, that's not his fault or problem. It's my feeling, not his. And so those are, common examples that show up all the time, is like, he's not making me feel this way. I choose to feel this way. And he never said anything. He never gave me a nasty look or anything like that. He's just managing his anxiety.
Right.
And I'm choosing to take that on.
Right. Yeah. So then how this is about you is your self-assigning non-fridge touching or use when you, in reality, you can touch the fridge.
Yeah. So I might ask, well, how is this about me in that way? And then I think these are my own fears or insecurities. I'm feeling insecure, or like I'm not allowed to go touch the fridge after he wipes it down. Well, where does that come from? And it might be something where maybe as a young child, I got yelled at because something got cleaned. Then I messed it up later and then I got in trouble. So I'm assigning that old scenario to a new scenario. And that's where I can, ask, how is this about me? Or what about this is about me? And uncover those real actual things that are going on.
Mm-hmm. Yeah. I love that. How is this about me? And then move on.
Yeah.
Mm-hmm. Yeah. All right. So I do want to get into some of the ways you've witnessed the impact of codependency on your patients, right? Acupuncture, hypnotherapy. But before that, can you give us a brief overview of what traditional Chinese medicine is, what acupuncture is, and what hypnotherapy is?
Absolutely.
Okay. TCM.
I'll be as brief as I can. So TCM, short for traditional Chinese medicine, it's a mouthful, and that it's a very broad topic. It's a very broad type of medicine, basically just saying like medicine, which could be, your primary doctor, it could be your endocrinologist, your rheumatologist, all these different people. So traditional Chinese medicine has multiple modalities under its umbrella. The primary one, or the most commonly recognized one in the United States, is going to be acupuncture. And so I'll explain a little bit more about that in a moment. But it also includes, TCM also includes things like cupping. We've seen a lot of the Olympians have cupping marks.
Mm-hmm.
That could be gua sha, which is an ancient scraping technique that works similarly to cupping. It just gets in different areas that maybe aren't accessible with the cups. Moxibustion is another modality under that. And actually, the Chinese character for acupuncture is not exclusive to acupuncture. It's actually acupuncture and moxibustion. They go together. Moxibustion is just an herb that is used on the skin to warm either a point or a channel. And then there's Chinese herbal medicine, as well as dietary suggestions, nutrition counseling, lifestyle changes, like I mentioned, Tai Chi and Qigong. It has a lot to do with our mental, emotional well-being. And so traditional Chinese medicine is very, very broad and all-encompassing. And it depends on the state in which a person is trained, but in the state of California, TCM is taught as a whole system. There's even a massage style that's included in that called Tuina. And so if you went to a school in the state of California like I did, you would be trained in every single one of these modalities. And then you have to be licensed in all of those modalities as well. And then you're licensed to practice under that scope.
Wow.
Yeah, it's very broad. And so most people think of just acupuncture, which is, like I said a moment ago, just a tiny fraction of TCM in itself. And acupuncture is using tiny, fine, we call them needles. I prefer to call them pins because needles can be scary for people. Pins are a lot less scary, and they're so, so tiny. And so we're more familiar with a needle similar to like having blood drawn or getting an injection. And so those needles are thicker and they're hollow inside so that liquid, either blood or what's being injected into the body, can pass through the syringe. Whereas an acupuncture needle is solid, it's not hollow in the middle. And I can't remember the exact number, but it's something like 20 or 30 acupuncture needles can fit into the hollow part of a blood draw needle.
Wow.
They're so fine and so tiny, it does not hurt. And
Mm-mm.
those needles are used to put into certain points. We learn there are 365 primary points on the body. And then I practice a system, which is a 700-year-old family style that has an additional 700 points. And
Wow.
so I utilize about 1,000 different points on the body. And so we put that needle in a specific point, and what it's going to do, it's going to stimulate blood flow. It's going to move the energy throughout the body, and it's actually very relaxing. Acupuncture will promote our parasympathetic nervous system. Many of us have heard about the sympathetic nervous system, which is fight and flight.
Mm-hmm.
And then we have to have the opposite. We need the harmony. So if we stimulate the sympathetic, we need to stimulate its balance, its opposite, which is the parasympathetic. And that allows us to rest and digest. And so acupuncture has been proven to easily put our body into that parasympathetic mode, the rest and digest.
Wow.
And then finally, hypnotherapy or hypnopuncture. I've combined the two, hypnotherapy with acupuncture. Hypnotherapy is a natural state that we go in and out of all day, every day.
Right.
We wake up in the hypnotic state. So I like to call it the magic 30. So 30 minutes after you wake up, you are in the hypnotic state. 30 minutes before falling asleep, you're in the hypnotic state just naturally. And during that time, when we're in hypnosis, we are just more open to suggestions. We are suggestible, is what we call it. And those could be positive suggestions or they could be negative suggestions. So I like to recommend that people spend that magic 30 minutes after waking, 30 minutes before going to sleep with only positive suggestions and positive information. There's a lot of negative information in the news these days, and that could be social media news or it could be the traditional news outlets. And so if the first thing you do after waking or the last thing you do before going to bed is look at social media and look at or watch the news or listen to any like news related podcasts, you're allowing that negative information to go directly into your subconscious. And our subconscious is important because it actually drives 90% of our life. Right. So our subconscious is programmed in early childhood and with repetition. So just like we brush our teeth 2 or more times a day, every single day, that repetitive habit has gone directly into our subconscious. And so we don't even have to think about it anymore. Oh, I need to go brush my teeth. It just happens. Right. And so as our subconscious mind is really driving the bus of our life 90% of the time, then if it's filled with a bunch of negative thoughts, negative habits, judgment about self and others, anything like that, then that's what your life is going to be driven by. So I recommend that magic 30. If you like to listen to podcasts like this one, this would be a great time to listen to all of those positive, uplifting messages. It's a great time for meditation. It's a great time for prayer. Anything that is going to start to steer your life in the direction that you want from a positive perspective. And with hypnotherapy, all we do is we tap into that hypnotic state, that highly suggestible state, at any time that I want. So I could induce hypnosis on somebody, give them positive suggestions for healing, and then they take that away. And that's what starts driving the bus, are those positive suggestions.
Wow. So they come in for acupuncture, right? You discern what of the 1,000 points they need, depending on what they're coming in for. And then while they're getting that treatment, they're also listening to positive suggestions?
Yes. So they could be listening to a recording that I've made them, or I might be sitting directly in the room with them and giving them positive suggestions.
Mm.
I do this a lot from a medical perspective. And I do it from a mental emotional perspective as well. So if one of my patients has a lot of anxiety, I might give them a tool. I call it an anchor, something that they can access easily on a regular basis, to bring them into that calm, relaxed state that we decide on. And it's also something where our minds are so powerful. And that's why I added hypnotherapy to my practices, because I learned about the power of our mind and how it can heal us. So I work with people who are going through cancer treatment, and we imagine their treatment, the chemo, the radiation, attacking the cancer, leaving the healthy tissue unharmed so that they can move on with their lives when they're done with the treatment. And so I teach them how to use their mind. So I teach them and navigate through that with them on how to use their mind. And it's not just cancer patients, it could be pain. There's a whole host of,
Codependency.
yes, exactly. A whole host of things that I do with people. I've worked with a lot of people with addiction, which that brings back to the codependency. A lot of people who have addiction issues oftentimes have a lot of codependency. And so we work on that. Like, how do they find themselves as an individual, and how do they cope? We can find better coping skills. You don't need to use alcohol or drugs to deal with the challenges that come up in life.
Mm-hmm. Yeah. All right. Well, speaking of your codependent patients, what are some of the ways you have witnessed the impact of codependency? Yeah, on their physical bodies, emotionally, when they seek acupuncture or hypnotherapy?
Great question. It can honestly manifest in any way. So without getting too too deep and too woo-woo and trying to do a master class on this, our emotions actually drive our physical condition. And it typically, if there's a dramatic emotional event, it takes anywhere from 1 to 3 years to show up in the physical body. And so I have tools and ways to determine, where is this emotion coming from, or what was the significant emotion, the first significant event that caused this emotion. Let's talk about anger. We determine what that emotion was. We know where it's showing up in the body, because maybe we are dealing with somebody who has shoulder pain. And it's especially these people who wake up and they're like, I just felt bad one day. I had this pain, I had this problem, and I had no injuries. I don't know what happened. So we start investigating. What was the event? Where did it come from? And then who is it associated with? So we have a masculine side of our body and a feminine side of our body. And so if it's on the feminine side of that patient's body, then we might explore, is it a mother? Is it a daughter? Or is it a sister? Something like that. Like, who else is a part of this? And then we can look for the codependencies in that. What was the relationship at the time? What is the relationship now? And these physical problems can manifest anywhere. And so each part of the body typically gives us a sign as to what that person is not dealing with. So let's say if we find out that it's related to a sister, that somebody got in a fight with their sister and now they're estranged from one another and they haven't talked to each other in 2 years and they are having wrist pain. Well, that indicates to me that they're not letting go of this experience. So I can help guide them with acupuncture, which, I might do for the wrist to help move the pain along, but I might guide them with the hypnotherapy and the hypnopuncture to allow them to resolve the problem, take responsibility for it, allow the problem to resolve within themselves. That doesn't mean that the relationship with the sister is better and they're friends again and they're talking. That's not what we're going for. It just allows the physical problem to get out of the body because that person now has taken responsibility and they have been able to let go or whatever it is.
Right. Each part of the body gives a sign of what we are not dealing with.
Exactly.
Yeah. Now, as you're talking, I've discussed this on the podcast before, but I've been to acupuncture, and yeah, at different phases. I remember I went, and at the time I was in a position, I was a baby therapist, just really just going, I say above and beyond, but just like, back breaking and bone shattering efforts for my patients. And I remember my feet, I used to sweat like I wasn't sweaty anywhere else, but I would get out of a session and my shoes were soaked. And yeah, I tell my sisters like, oh, like my feet smell, my feet are sweaty. And they had similar symptoms as well. And I went to an acupuncturist, and I don't even know if I told her the symptom. She must have sensed it. She was like, do you have sweaty feet? And I was like, I do have sweaty feet. It's a terrible problem, but maybe we're going through a checklist. And that was one manifestation, right? My sweaty feet were a sign of what I was, one sign of what I was not dealing with. I had a couple, I lost my period. Actually had a doctor who thought I had hyperthyroid, but it was anxiety.
Mm-hmm.
So, yeah. So I do.
I might,
go ahead. Yeah.
With how I practice and what I know, I might, looking back on that experience with the sweaty feet. So our feet have a lot to do with allowing escape. So I would venture to guess that because you were doing this, back, like bending over backwards, bone breaking work with people, you were not in full alignment with that. You want to help your people, and you probably didn't feel validated or valued in some way with all the extra that you were giving, that your body was saying, okay, we need to run the heck away from this situation to get your body back into a healthy state. And that's where, I don't have every body part memorized. I do check my references from time to time, but these are the things that I would communicate with my patients. Had you come to me, I would have said something like, do you feel out of alignment to the point that your body's telling you you need to walk away?
And like, yes, exactly. Dr. Sharleen, yes. It's so hard.
And then we can come up with a plan. And honestly, just by acknowledging the emotions that your physical body is trying to show you, just by acknowledging that, the symptoms would start to resolve on their own. You don't have to leave your position, because especially when it comes to work or family, we can't just always walk away. And it's, it's something that we get to learn how to cope with in a better manner.
Right.
And that's what I teach my patients to do.
Yeah. No, I remember I went and she helped me, like all of a sudden Flo came back to town, and eventually it really was that I had to leave that position. But Yeah, I love this. Each part of the body gives a sign of what we are not dealing with. Mhm. What are some of the long-term consequences if we don't address, right, these physical symptoms, the emotional symptoms of codependency, according to TCM?
So really, it's the long-term consequences are chronic disease.
Mm.
And in today's society, again, all of us having codependency issues at one point, maybe our whole lives, with certain people, not with others, whatever that may be, and not learning the tools like what you do with your patients is, you teach your patients the tools to deal with this and to get better as humans. But not everybody seeks therapy. Not everybody seeks treatment with somebody like me. Not everybody is taught this at any stage, really. So what we're finding is more and more in our society is chronic disease, chronic conditions. A lot of that might be an autoimmune disorder. Autoimmunity has been on the rise for the last 20 years at an alarming rate. And all autoimmunity is, I'll just give a couple of common ones that I see. That's like Hashimoto's, an issue with the thyroid, rheumatoid arthritis. So that's when the joints get disfigured and very painful. Lupus, that's another joint related disorder, but it can also attack the organs in the body. Multiple sclerosis, which is a neurological disorder and can be debilitating and have people wheelchair bound. And then even cancers. If we don't resolve the emotions, especially around anything related to codependency, these are the long-term consequences with our health, unfortunately. And there aren't always good medical solutions, especially in the autoimmune realm. But, no one wants to hear the C diagnosis. No one wants to be diagnosed with cancer or really anything. We just want to be healthy and feel good and thrive and have fun in our lives and play with our kids or grandkids and go out and do the things. And it's, that's limited when you have a chronic condition.
Right. So arguably chronic codependency or chronic what is the word? I want to be careful. It's not avoidance, but just like chronic not addressing of things.
Or maybe even lack of awareness.
Yeah.
Some people are even unaware that they have these problems. I was until a few years ago. And then still, I bought the book right away and I didn't start practicing, anything for many years.
Yeah. So, yeah, lack of awareness, long-term. Here, we're talking about, especially with codependency, can contribute to the manifestation of chronic conditions.
Yeah.
Yeah. And what are some of the, right, we did discuss some of the work you do with acupuncture and hypnotherapy. Other initial steps you take with your patients to combat codependency in their lives?
Yeah, this is something I do even in the initial intake. I have a very lengthy questionnaire that my patients fill out before they even arrive for their first visit. And nearly half of it is seemingly unrelated to our health, although it's probably the most related to our health. And that's things like, are your relationships harmonious? Like, do you like your job and your coworkers? And so in a lot of this, I'm looking for how much alcohol they drink, if they use any kind of legal or illegal drugs. And I really look for my patients to be honest about this because one, I'm not going to judge you. Two, I'm not going to report you. And three, that just means there's room for improvement. And so I start looking for red flags that we can address from the get-go. I do a lot of work with my patients to allow them to have a better just lifestyle in general. We work a lot on food and our relationship with food. And so I want to know if there's codependency in the family unit or their home life, because if I'm asking them to change their dietary habits, eliminate certain foods that we know are very inflammatory, as well as add in new healthier foods, do they have a situation at home where that home life is going to be supportive? Do they have partners? Do they have parents? Do they have children who are going to support them in this journey? Or are they going to try to sabotage? And this is not intentional sabotage. This is somebody who's like, well, I eat like crap, so I want you to keep eating like crap so I feel good about myself. And that's where I'm looking for those codependent situations, because most of us have them. And when I find that in a patient, I get to communicate with them differently. I get to teach them how to operate at home, how to talk to their partners and say, you know, I'm on this journey. I'm investing a lot of time and money into this so that I can feel great at the end of every day. And I would love for you to come along with me. I would love for your support. I'm not asking you to make these changes with me. I want your support. So that codependency is very important, especially when I'm dealing with anybody who are using substances of any kind to handle the daily stressors of life. You know, is somebody going home and having 2 glasses of wine every day because they see their partner doing it, because both of them have stressful jobs? We need to figure out the codependency here and find solutions so that they can come into their own, be more of their own person, and make healthier choices.
Right. So I'm hearing you give the medical prescription, which is easier said than done, right? Change your diet. Stop drinking alcohol or take a break. Practice Tai Chi. And I think due to TCM's perspective on harmony, right, internally and externally, then your second step is to ask, how will what I'm prescribing have a ripple effect on your relationships? And if you're worried about that impact, let's problem solve through that too, because you need both.
Exactly.
Yeah.
The mission for my business, especially, and even in my life, is to transform the health of our planet in 2 generations or less. And I didn't stop at transform the health of our planet. I continued on with that in 2 generations or less, because if I can impact the moms and the dads at this level now, they will have an impact on their children. And so the younger generations will actually be the ones to make the lasting change. And it starts with my patients who are the parents.
Right. I love that. Yeah. I tell people often there's intergenerational trauma, which is trauma passed down. And I say, I'm in the business of intergenerational healing, which is possible, right? But through interventions like TCM, therapy, etc.
Absolutely.
Yeah. Yeah, you're making me think. Recently, I think it is one of the impacts long term of my codependency. There's also genetics, but yeah, there's also modeling in my family. And my bad cholesterol, recently I got it tested, and it was pretty bad. And I was like, oh, I was terrified. And yeah, thankfully talked with my doctor. I've been taking action, and also sensing it is a sign of some long-term consequences. I'm all chill, Sharleen. I'm very, very calm in a lot of public spaces, but internally my heart and my arteries are like freaking out. So they're exhausted for different reasons. And I came home, and I also do. I like to snack. I like to eat processed food. And so I told my husband, I was like, we gotta take a haul and just get rid of a lot of stuff. And he was like, finally. And I was like, oh, thank you. Because not being codependent, I guess kind of, but just bad habits are contagious. And so when I was eating crappy, he'd indulge too. And yeah, he's like, oh my gosh, yes, like finally. But having his support has been that much easier. And yeah, I think in previous relationships, maybe not so much so with this issue, but not wanting to cause any ripples. Yeah, I think it would have been harder for me to share or make changes because of the impact it would have on the relationship.
Yeah, and that's a major concern and problem with most people, especially women, because we just naturally think of others, and in our society we're trained to consider other people along with ourselves. And I know that's even something I've experienced in my relationship with my husband. I want to eat a certain way or eat certain foods, and that has an impact on him. And so it's finding that, both of us can enjoy foods in a certain way. And you'll have to go listen to my podcast episode on cholesterol, because it's not as scary as the doctors may make it sound.
Okay.
It doesn't always mean that you're at high risk for heart disease, and it's very, very easy to manage.
Right.
And you've already taken the perfect action to managing that by getting rid of all the junk snack food, and snack on real food. By
Right.
all means, snack as much as you want. And just, I always say, if it comes in a box or a bag, or if you have to buy it in the center aisles of the grocery store, that's going to do more harm than it does, make your taste buds happy. Right. So shop the perimeter of the grocery store, snack on all of that stuff as much as you want, and you'll be just fine.
Yeah. And also work on my boundaries and yeah, all that.
Always.
Yeah.
One of those boundaries is to avoid the center aisles of the grocery store.
Yeah. All right. Any other steps you take to combat codependency in your patients' lives?
Yeah, it really just depends on each person, and the level of codependency that I might be seeing in a patient might require more in-depth steps or work or conversation. And there's actually a technique that I learned earlier this year that I've started implementing with a lot of my patients, especially my hypnopuncture patients, and I love it. It is called timeline therapy. And Marissa, you'll understand this, so I'll explain it real quick for your listeners who maybe aren't trained in mental health, but there is something called the Gestalt emotions, and there's good and bad. There's, positive ones and negative ones. And so the basic negative Gestalt emotions are going to be anger, sadness, fear, hurt, and guilt. And so what I do is I take my patients back to their childhood. We imagine events from their childhood, real events that happened where they very first experienced anger, sadness, fear, hurt, or guilt. It might be multiple events. It might be the same one. And that could be they experienced the emotion themselves, or they could have witnessed it. It could have been the first time they witnessed anger, from a parent possibly, or some kind of event. And each of those events are designed to teach us something about ourselves, and they're all positive lessons. And it might be that you're powerful, you are abundant, you are pure love. It might be those types of things. And so what we do is we gather all of those lessons from that event, and then that patient is able to actually take those learnings into the present and on into the future. And when I have patients who are dealing with, really intense codependency, they're really struggling to get out of this experience. They're having a hard time finding who they are. This type of treatment will actually allow them to figure that out, because we do, go back to find the learnings of who are you at your core.
Right.
And it's been very powerful. So it really just depends on the person, what they need, the level of codependency they're dealing with. Have they worked with you in the past and they're like so far along already, and we just need to kind of release a couple of things from their body with the acupuncture? Or is this the first time they're going through this, and, or that they're aware of it, and we need to help them clean up a lot of junk from the past?
Yeah, I love that. Timeline therapy, right? To bolster this all-encompassing service that you provide.
Exactly. And then acupuncture is, of course, a piece of that, because we want to use certain points to allow the negative to release from the body. So I incorporate that as well.
Awesome. Yeah. All right. Well, I'm curious if you can tell us about your free mental health ebook that you're offering everyone.
This is something I don't recall when I launched it. I want to say it was May of this year, May of 2022, because May is Mental Health Awareness Month. So if I had planned it right, and I don't recall exactly when I did it. And I really just put together a lot of the free resources that I use to stay on a healthy mental health track. Or even, when we have those struggles, I suffer myself from anxiety and sometimes depression. And so I put together the tools into a small ebook. I can't remember how many pages it is, 6 to 10, something like that, of just the techniques that I use. And all of them can be used at any time, anywhere. So I offer breathing techniques that have worked great for me. I read a book by Mel Robbins called The High Five Habit, and she has a couple recommendations in there. When she is feeling anxiety, she puts her hands over her heart and repeats to herself, I am safe, I am loved, I am okay. And just that in itself can help bring anxiety down. And then I have a link in the ebook at the end to also find a free hypnosis recording that I created. That's about 10 minutes long, where, as long as you're not driving, do not listen to hypnotic suggestions while you're driving. But if you're in a safe, quiet space, listen to it, and it can help put your mind at ease and get you into a calmer, healthier state.
Awesome. Well, yeah, we'll have a link to that in the show notes. And where can people find out more about you?
They can find me. I'm all over the place. So I have a website which will be under construction soon in the new year in 2023 as I bring on more health practitioners and team members. And so that is empirewellnesscenter.com. And you can always reach out to me via email, which is hello@empirewellnesscenter.com. And I'm most active on social media on Instagram. And so my Instagram handle is EWC Health. And I have a great intern who runs my social media. And so she makes it super fun. And we do a lot on there for mental health support. Mm-hmm. Not necessarily codependency specifically, but I know one of the breathing suggestions I have in my ebook, my favorite breathing technique that I use, she actually put together a reel to have, you can just sit there and breathe along with it and it counts for you. It's really fun.
Wow, awesome. Okay, so we'll put links to that, you guys, in the show notes as well for you to check out. And I'm going to listen to your cholesterol episode. And thank you for coming on.
Yeah, thank you, Marissa, for letting me share.
Mm-hmm. Okay, everyone, we'll see you next week. Bye.
Hey girl, it's Marissa again. I'm not like a regular podcaster, I'm a cool podcaster, right? Thank you for listening and staying till the end. You can find me on Instagram @therapywithmarissa. Email me, marissa@codependummy.com. Check out codependummy.com for more information on the show. And baby girl, a subscribe, rating, and review would be much appreciated. Till next time, I want you to remember, if you are feeling unseen, I see you. If you are feeling unheard, I hear you. And if you think that you don't matter, know that you matter to me. I want you to go out there so you can stop playing small and start taking up space, you dummy. And now, the disclaimer. Girl, this is not therapy and I am not your therapist. This podcast is designed to provide accurate and authoritative information in regards to the subject matter covered. It is given with the understanding that neither the host, publisher, or guests are rendering any legal, clinical, or other professional service. If you want or need a professional, please